Now, our next story is from Kenya. A prolonged, devastating drought has been wreaking havoc across the East African nation. The World Health Organization says that over 2 million Kenyans are at the risk of malnutrition and face an increased risk of disease outbreaks. The drought is no longer restricted to Kenya's arid northern counties, but it has spread across the nation. And the drought is causing widespread losses to agriculture workers.
The animals that we have remaining are so emaciated, we do not know how we can revive them so that they can regain their weight. We've lost around 110 cattle, about 300 goats. They were the most affected. We have about 1,100 remaining now.
Around 110 evil.
The drought has also exacerbated another problem. It has led to a rapid increase of sandflies. Droughts, interspersed with periodic floodings, serve as an ideal breeding ground for sandflies, and their spread has led to a health crisis in Kenya. The country has seen a surge in cases of visceral leishmaniasis. The disease is also known as kala-azar.
One of the biggest problems we had in terms of diseases was kala-azar. That really scared us last year because we had no clue what disease this was because we were mostly used to malaria. So when you got tested, you would be diagnosed with dengue fever. But after a while, we lost a number of our colleagues and more tests were done. And we were told it's an insect spreading a disease called kala-azar. It infected a number of our colleagues who needed to be treated as soon as possible.
Now, the number of kala-azar cases in Kenya more than doubled between 2024 and 2025. And reports say that this disease has a 95% fatality rate if left untreated. It is often misdiagnosed as either malaria or dengue, which often prevents it from being treated in time. Even when properly diagnosed, the treatment cycle for kala-azar can last 30 days and involves daily injections and frequent blood transfusions. The cost of the treatment can go up to 100,000 Kenyan shillings, which is about $775. And that is without accounting for the cost of the medicine. And thus the disease ends up devastating Kenya's poorest and most vulnerable communities.
I thought I was dying. I was critically ill. I went to the pharmacy and paid 6,200 Kenya shillings, and they told me that I had malaria, that I had an infection in the blood, and that it was dengue fever. It was such a misfortune. It was worse than all the diseases they thought I had.
Now, the outbreak of kala-azar has been most severe in the counties of Turkana, Wazir, Marsabit, Mandera, and Samburu. At least 500 cases were detected in Wajir County alone. The Kenyan government has ordered fumigation campaigns and deployed mobile laboratories to treat people in remote regions. But the disease continues to spread and add more misery to the Kenyans already reeling under drought.